Today, I want to speak about a health issue that affects millions of people worldwide, often silently, without warning signs or symptoms: high cholesterol. Many individuals discover they have elevated cholesterol only after routine blood work, and by then the conversation frequently turns to medications, particularly statins. Statins are among the most commonly prescribed drugs in modern medicine. They are effective, widely studied, and life-saving for many people. Yet, despite their benefits, a significant number of patients hesitate when statins are recommended. Some worry about side effects such as muscle pain. Others feel uneasy about long-term medication use. And many simply ask a reasonable question: is there a natural way to improve my cholesterol first? This question is not rooted in denial or misinformation. It reflects a desire for control, understanding, and sustainable health. As lifestyle medicine physician Vanita Raman explains, many patients want to know how much improvement is possible through diet, physical activity, and weight management before committing to medication. Today, I will walk you through 3 natural, evidence-based alternatives to statins, not as replacements for medical care, but as powerful tools that may lower cholesterol, reduce cardiovascular risk, and in some cases, delay or complement medication use. These strategies are grounded in nutrition science, metabolic health, and long-term disease prevention. Before discussing alternatives, it is important to understand why cholesterol is taken so seriously. Cholesterol itself is not the enemy. It plays a vital role in hormone production, cell membranes, and digestion. The concern lies with excess low-density lipoprotein, or LDL cholesterol, often referred to as bad cholesterol. Over time, excess LDL can accumulate along artery walls, narrowing blood vessels and increasing the risk of heart attack and stroke. This process is gradual and silent. You do not feel plaque building up in your arteries. You do not receive early warning signals. That is why elevated cholesterol, even in people who feel perfectly well, is considered a serious risk factor. Statins are effective because they reduce the liver's production of cholesterol. On average, they lower LDL levels by 30 to 50% and reduce the risk of cardiovascular death by approximately 25 to 30%. Importantly, doctors are not trying to treat a lab number. They are trying to prevent heart disease, stroke, and premature death. Cholesterol is simply a marker, a surrogate for that deeper risk. Treatment decisions also depend on multiple factors: age, blood pressure, blood sugar levels, smoking history, body weight, and whether someone has already experienced cardiovascular disease. For individuals who have had a heart attack or stroke, statins are strongly recommended alongside lifestyle changes. However, for people without established cardiovascular disease, sustained improvements in diet and lifestyle can sometimes lower cholesterol enough to reduce or delay the need for medication. That is where natural alternatives play a critical role. Natural alternative number 1: eating more soluble fiber. Among all dietary strategies for lowering cholesterol, soluble fiber stands out as one of the most effective and well-studied. Soluble fiber works by binding to cholesterol in the digestive tract and helping remove it from the body before it enters the bloodstream. This is not theoretical. It has been demonstrated repeatedly in clinical research. Dr. Raman has observed this effect firsthand. In her research involving individuals with diabetes, participants who followed a plant-forward, high-fiber eating pattern experienced significant reductions in cholesterol levels, even though cholesterol was not the primary outcome being studied. This finding reinforces a powerful truth. When you improve dietary quality at a foundational level, multiple health markers often improve simultaneously. Soluble fiber is found in everyday, affordable foods. These include beans and lentils, oats and barley, apples, citrus fruits and berries, vegetables such as carrots and Brussels sprouts. Making soluble fiber a daily priority is essential. One practical recommendation is to include beans or lentils at least once per day. Starting the morning with oats instead of refined cereals or adding barley to soups and salads can have a measurable impact. Just as important as what you add is what you replace. Foods high in saturated fat, such as red meat, butter, cheese, and full-fat dairy, raise LDL cholesterol. Replacing them with unsaturated fats from olive oil, nuts, seeds, and avocados can lower LDL over time. These changes do not need to be extreme. Even modest, consistent swaps accumulate benefits over months and years. Natural alternative number 2, physical activity and weight reduction. The second natural strategy is regular physical activity, particularly when it leads to sustainable weight loss. Body weight and cholesterol levels are closely connected. Excess body fat contributes to higher LDL cholesterol, higher blood sugar, and higher blood pressure. These risk factors rarely occur in isolation. They tend to rise together and amplify one another. When people lose weight, especially visceral fat around the abdomen, cholesterol levels often improve as a result. This is not merely cosmetic, it reflects a fundamental improvement in metabolic health. Physical activity plays a central role in this process. Exercise helps lower LDL cholesterol, raise good HDL cholesterol, and improve insulin sensitivity. Importantly, these benefits can occur even without intense workouts or dramatic weight loss. Walking most days of the week, staying active throughout the day, and reducing sedentary time can meaningfully improve cardiovascular risk. Consistency matters more than intensity. For many people, a daily walk is more sustainable and impactful than short bursts of extreme exercise followed by inactivity. You may have heard about newer weight loss medications, such as GLP-1 receptor agonists, which have been associated with improved cholesterol levels. However, it is important to understand that these drugs do not act on cholesterol directly. They suppress appetite, leading to weight loss, and weight loss itself improves cholesterol. This distinction highlights an important lesson. Lifestyle-driven weight management remains a powerful and direct way to improve cholesterol without targeting it pharmacologically. Natural alternative number 3, comprehensive lifestyle change. The third natural alternative is not a single behavior, but a holistic lifestyle approach. Diet, movement, sleep, stress management, and body weight are deeply interconnected. Addressing one area often leads to improvements in others. For example, regular physical activity improves sleep quality. Better sleep supports appetite regulation. Improved appetite control makes healthy eating easier. And together, these changes reduce cardiovascular risk. One challenge is that meaningful dietary change is not easy. Transitioning to a high-fiber, plant-forward eating pattern requires planning, habit formation, and patience. The results are not immediate, and that can be discouraging in a world accustomed to quick fixes. However, lifestyle changes offer benefits beyond cholesterol. They improve blood pressure, blood sugar, inflammation, energy levels, and overall quality of life. Medications can target one pathway. Lifestyle change addresses the root system. That said, lifestyle approaches are not appropriate for everyone as a standalone strategy. Individuals with established cardiovascular disease, very high LDL cholesterol, or multiple risk factors often need statins in addition to lifestyle modification. This is not a failure, it's personalized, evidence-based care. As we conclude, let's return to the original question. Are there natural alternatives to statins? The answer is yes, but with important nuance. Eating more soluble fiber, staying physically active, managing weight, and adopting a comprehensive healthy lifestyle can significantly lower cholesterol and reduce cardiovascular risk for many people. These strategies are not fringe ideas, they are supported by decades of research and clinical experience. At the same time, statins remain a critical, life-saving therapy for individuals at high risk. The goal is not to frame medication and lifestyle as opposing forces, but as complementary tools. The most effective approach to cholesterol management is not ideological, it's individualized. It respects patient preferences, medical history, and long-term risk. It begins with informed choices and sustained habits guided by healthcare professionals. High cholesterol may be